Hello guys, so today we shall be discussing another kind of protozoal infections, that is Trypanosoma cruzi, right? So basically guys, if we divide the protozoal infections, right? If we divide the protozoal infections, I hope all of you might have known what are the different types of protozoal infections. For example, there are some protozoal infections, right? So there are some protozoal infections which affect your CNS. I mean, there are some protozoas which are specifically affecting your central nervous system. In the same way, there are another group of protozoas which mainly affect your gastrointestinal system. There are third group of protozoas which affect your visceral organs. These group of protozoas, they affect your visceral organs. You called as visceral protozoal infections. So what are these protozoa which affects my visceral organs? What are these protozoa? The first protozoa which I want to discuss is, one is your Trypanosoma cruzi. Trypanosoma cruzi is the first one. And what will be the second one? The second one is Leishmania donovani. Leishmania donovani. So Trypanosoma cruzi and Leishmania donovani, both of them, they mainly affect your visceral organs. That is why you called as visceral protozoal infections, right? So basically there is nothing much needed to know regarding both of them. They are pretty small. So we shall cover both of these topics in a single lecture itself. Okay. So the first thing here comes is your Trypanosoma cruzi. Trypanosoma cruzi. Now, when you come to Trypanosoma cruzi, all of you might have known this, I think, that whenever I tell this bug, the one thing that comes into your mind is Chagas disease. Yes, you are right. This causes Chagas disease. This causes Chagas disease. Can anyone tell how Chagas disease is transmitted? Chagas disease is transmitted with a small insect, right? With a small, let us say, small bug, that is called as kissing bug. Okay, so how do I get Chagas disease? Through this kissing bug or to this kissing insect or whatever it is. Inside that there are trypanosomiates, right? Or this Trypanosoma cruzi. So if it bites me, that kissing bug bites me, so obviously that trypanosoma enters into my body and obviously it affects my visceral organs, right? So basically what I'm trying to tell you is that this Chagas disease transmission, how does it transmit? It transmits with the help of a special bug, and that is called as kissing bug, right? So if someone asks you what is kissing bug, can anyone tell? Can anyone tell the other name for kissing bug is triatomine. Triatomine is the other name for that kissing bug, right? So where do you find this Chagas disease most commonly? Most commonly we encounter Chagas disease in South America. Most common location is South America. So those people who are coming from South America after their vacation, so those people are most commonly affected with this disease, right? So this bug, whatever is that, this kissing bug, if whenever it bites, you won't have any pain. This is called as a painless bite. Okay, so it will bite there, it will make a small hole, right? That is a painless bite, and in that hole it will deposit its feces. So in that feces you find these trypanosomiates. Okay, so this bug has got, this is a painless bite, painless bug, right? Painless bite that deposits the feces. It causes painless bite that results in deposition of feces. There are two types of infections regarding this trypanosoma, guys. What are the two different types of infections? Are One is called as an acute infection. One is called as an acute infection and the other one is called as a chronic infection. So one is your acute infection and the other one is called as a chronic infection. So these are the basic two types of infections which it causes. So what is acute infection? What do you find in case of acute infection? You find a specific sign. What is that specific sign is that only one part out of two eyes, only one eye is surrounding the eyeball, right? This is called periorbital region. So there will be periorbital swelling. That too, not two sides, only one side. So I call it as unilateral periorbital swelling. Periorbital swelling. What is that called as, guys? That is unilateral periorbital swelling. Right? So this particular unilateral periorbital swelling, you also called it as Romana sign. This is also called as Romana sign. And this Romana sign is very important, guys, because this Romana sign is the characteristic for Trypanosoma cruzi. It is a characteristic for Trypanosoma cruzi. And what is chronic infection? Chronic infection is that infection which you see in over time. Right? If you get affected with this disease, after a lot of time, right, maybe an year like that, you start slowly developing this chronic infection. And what is this chronic infection? There are three things in this chronic infection which you need to know. And what are these three things which you need to know? One is with the heart, one is with your intestine, and one is with your esophagus. That is, there will be dilated cardiomyopathy. Patient gonna have dilated cardiomyopathy. Apart from the dilated cardiomyopathy, he is also gonna have megacolon. And finally, he gonna have megaesophagus. He gonna have megaesophagus. Right? So these are the three basic conditions. And what is Romana sign? The Romana sign is, as you can see here, this boy is having swelling only on one side of his eye, right? So there is unilateral swelling of his eye. There is unilateral swelling of his eye, right? So this unilateral swelling of his eye is called as Romana sign, right? So when it comes to dilated cardiomyopathy and megacolon and megaesophagus, you know, megacolon in the sense the colon size will be more, megaesophagus in the sense the esophagus will be dilated. But when it comes to dilated cardiomyopathy, so this is the picture of dilated cardiomyopathy. As you can see, the heart border is pretty much dilated till here, right? Till the peripheral lung fields. The heart border is dilated. So this is a case of dilated cardiomyopathy. This is dilated cardiomyopathy. So what is the diagnosis which you basically do, guys? How will you diagnose this case? Yes, the basic diagnosis which you do is peripheral blood smear. Peripheral blood smear. Now, in this peripheral blood smear, what is the thing which you find? In the peripheral blood smear, you find trypomastigotes. You find trypomastigotes. Trypomastigotes are found in peripheral blood smear. So this is a picture of trypomastigotes which you can very clearly appreciate here, right? So these are found on peripheral blood smear. When it comes to the treatment part, what is the basic drug you give? You give, yes, benzidazole. After Trypanosoma cruzi, the next protozoal infection which we will be discussing basically is Leishmania donovani. So this is the next protozoal infection which will be concentrating on, that is Leishmania donovani. So obviously all of you know Leishmania causes Leishmaniasis. And what type of Leishmaniasis? I told you it mainly affects the visceral systems. That is the reason why it is causing Visceral Leishmaniasis. Visceral Leishmaniasis. Visceral Leishmaniasis. Can anyone tell what is the other name for this Visceral Leishmaniasis? It is also called as Kala-azar. It is also called Kala-azar. And or all of you know this is black fever. Black fever or Kala-azar. Right? So there are two types of leishmaniasis, guys. One leishmaniasis affects the visceral organ, so I called as visceral leishmaniasis. The second one affects your skin, so I call it as cutaneous leishmaniasis. Cutaneous leishmaniasis. Right? So if you look at the transmission route, what is the mode of transmission? If you basically look at the transmission of this leishmaniasis, obviously this leishmaniasis transmits through the sandflies. Previously there it was kissing bug, right? In trypanosoma, here it is sandfly bites. Sandfly bites. So as I already told you, there is a typical leishmaniasis called as visceral leishmaniasis. So if it is visceral leishmaniasis, what are the different types of symptoms which you find? You're gonna have swelling of your liver as well as spleen. You call this condition as, yes, hepatosplenomegaly. Apart from that, patient is also gonna have weight loss. Patient is gonna have weight loss. And third thing is, patient is gonna have spiking fevers. So hepatosplenomegaly, weight loss as well as spiking fevers. So this is the concept of visceral leishmaniasis. When it comes to cutaneous part, as I told you, right, there are two types, visceral and cutaneous leishmaniasis. In cutaneous leishmaniasis, what do you find? What do you find is that you find small papules on the skin, right? All these papules join together, right? All these papules, they mix together and finally result in a big ulcer formation. So in this particular leishmaniasis, cutaneous, you find papules and these papules merge together to form an ulcer. Right? The papules progress to form ulcer. And how do you diagnose this? Obviously, the diagnosis part is important. So you diagnose this by doing a needle aspiration. So when you do a needle aspiration, what do you gonna find in that aspirated material? What you will find is that you find that the macrophages have engulfed these Leishmania protozoans. It means the macrophages have engulfed these amastigotes. So you will find macrophages phagocyting or engulfing these amastigotes. This is the basic thing which you will find. Now when it comes to the treatment part, so what is the basic treatment which I try to give to my patient, guys? Obviously the treatment is amphotericin B. So this is the end of the lecture. Thank you.